Thanks, Glenn. Now it's time to answer some common health questions. Joining us is News Channel 5's medical expert, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. First of all, thank you for coming in, Doctor.
You're welcome, Mike.
We've seen the spraying for mosquitoes. It's headlined our AM crew stories here for the past couple of days. We're talking about dengue fever and the signs and symptoms and what can be done about it. What can you say about that,
Yeah,
Doctor?
sure. Well, what people need to realize is it is a very common infection. Over 100 million people every year worldwide can get it. So what do you do? Well, one thing we want everyone to know, and that is that it is mosquito to human. It is not human to human. So, all right, so what do we need to do? Well, a couple things. One is, first of all, recognize the symptoms. It occurs about 4 days after exposure and can last up to about 10 days. The type of symptoms you're going to have are as follows: high fever, severe headache, many times behind the eyes. You can develop a rash, achy joints, achy muscles, and then in severe forms you get the hemorrhagic form, which is bleeding from the nose, gums, and easy bruising. So what's the treatment? Well, unfortunately, there is none. There's no treatment and there's no vaccine. It's supportive care, fluids, things like that. So what do we need to do? What's the best thing we can inform our viewers? And that is avoid exposure. Stay indoors when possible. Obviously, if you have to be outside, use repellent, long sleeve shirts, long sleeve pants, and then of course avoid the breeding of mosquitoes outside your home. Keep standing water to a minimum. Get rid of the flower pots, the tires, the barrels, the buckets, things like that, and that'll put you at least risk.
And worst case scenario, if you do come down with dengue fever, it is just a nursing yourself back to health type thing.
You bet. And we always recommend you come see us, whether it be in the emergency department or your doctor, just in case your symptoms are severe. We'll be happy to take care of those.
Okay, one of the biggest killers in America, stroke. We want to know what the symptoms are of a stroke so you can recognize it.
Well, you know what's important is that we did a great job in the past of educating people on heart attacks. Everybody knows what to look for in the face of heart attacks. Well, a stroke is a brain attack, and so it's very important. Every 40 seconds, somebody suffers from a stroke, up to almost 1 million every year. And so it's very important to understand why that occurs. It's a blockage of a blood vessel that goes to the brain, so you're going to have a specific neurologic symptoms, typically weakness or numbness in the arm, leg, typically on one side of the body, a facial droop. You can have confusion, dizziness, and then difficulty speaking. So one of the mnemonics, easy ways to remember the symptoms of stroke is as follows. Remember FAST, F-A-S-T. So you get facial droop, arm weakness, speech difficulty, any of those three. The T is now it's time to call 911. Okay? Do that because like a heart attack, a stroke, the sooner it's recognized and the sooner you get to us for treatment, the better the outcome.
Time lost is brain lost.
You bet.
Okay,
You bet.
the sooner the better.
Just like with a heart attack, time is muscle.
All right.
You got it.
Thank you very much, Doctor.
You're welcome.
If you have a question for Dr. Soria, send it in. Go to our website, WPTV.com, and simply click on the health link. Scroll down on the right-hand side. You'll see a form to write your question.